Poso maoni wiak, waiwanan kitanan ni mua e yoski piataya posnotaman e yum MITW Podcast. A yospis piataya posnapi notaman e ne hisikimaka e yoso matnamin e hakihi.
Welcome to the Menominee Indian Tribe of Wisconsin podcast. We are your hosts, Gary Dodge
and Sheena Wapus. On this episode, we are joined by Vaughn Bowles, Public Information Officer for the Menominee Indian Tribe of Wisconsin. I would like to remind everyone that we request you send in your COVID-19 related questions to us at podcast@mitw.org. Welcome, Vaughn.
Thanks, guys.
Happy Friday, everyone.
Yeah, happy 2021.
Yeah, this is our first podcast of the year. So, is it true there's a more infectious version of the virus that is spreading right now?
Yes. So, in the United Kingdom, they've identified a new variant of COVID-19. They designated it B117, and they have found this to be a more infectious strain of the virus. Depending on the study, they've found it to be about 56 to about 70% more virulent than previous strains of COVID. And they found that this is due to the body actually building up higher volumes of the virus within it. Good news, I guess you could say at this point, is they haven't seen that this variant is more lethal. But if you have the possibility of infecting more people, obviously more people can die. So it is of concern, and Incident Command has been briefed on it, and it's something we're keeping an eye on.
Do we know if the current vaccines that we have still are effective for it?
They assume that the current vaccines will be effective for it because the spike protein hasn't changed as far as they know, and so that's what the vaccines are targeting, and so they assume that the vaccines will still be effective for this variant too.
Okay, speaking of vaccines, will vaccination be offered to MITW employees through work?
Short answer is yes. All the tribal employees are eventually going to be vaccinated, but it may take some time. We're kind of following the recommendations and the guidelines of the state of Wisconsin as far as our distribution plan goes. So we'll hopefully eventually be able to vaccinate everyone, given supply demands and production.
So do you still have to wear a mask if you've had COVID, you've recovered, and you're out in public?
The CDC is recommending it, and so we're still encouraging that. You can still transmit various viruses and impact, the immunocompromised and stuff. So they're asking that, if you've had COVID, if you've been vaccinated, please still wear a mask. There still is a chance that even if you have been vaccinated, you can contract the virus. Even if you've had COVID before, you can still be reinfected. It's ultra slim, but it's still there, and so they're still asking for mask usage.
When will the COVID vaccine be available for tribal members?
So that's the major question we're all asking right now. So right now we're receiving the Moderna vaccine through the state, and they're obviously getting it through the allotments of the federal government. The federal government is doing it by population base. So Wisconsin, we only have 5.5 million people in the state. We're obviously getting less doses than, say, California, Texas, or New York that have, a much higher population. So right now, our supply is, not quite up to demand. The state's getting about 70,000 doses per week. When that trickles down to what we're receiving, it's usually between 100 and 200 doses a week. So we're working on it. It's not quite as fast as anyone would like, but eventually we should be able to vaccinate the community too. Yeah.
Is it a process for the ways the vaccine is given out, like, for example, like frontline workers or elders?
Yeah. So the Wisconsin plan, they've broken it up into several phases. Phase 1 actually has 3 parts. So there's a phase 1A, which is like healthcare workers, and long-term care staff and any elderly that might be in long-term care. from what I've heard, we're pretty much done with this 1A phase in the community, which is great news. And then, there are also individuals that may be brought into contact with the virus in the line of duty. Law enforcement, corrections officers, EMTs, they count in that area too. After that, it moves to 1B, which is like essential workers. They haven't made this hard and fast, but they're looking at people in public health, transportation, communication, food and agriculture, finances and tech infrastructure and stuff. So, telecommunications stay up and running. After that, the state wants to go to a 1C, which is, residents over the age of 65 and, individuals with underlying health problems, respiratory conditions like COPD, anyone that may be immunocompromised, HIV positive individuals, people that have compromised livers and kidneys and things like that. After that, it moves to phase 2, and they're going to look at what they call critical populations. And then after that, phase 3 will be critical populations and general population. So it's rolling out slowly. They're still working out, who gets it when, but that's the general plan currently.
Okay, and then kind of a personal question, but were you vaccinated, and what are some of the symptoms that you felt after getting vaccinated?
So I actually haven't been vaccinated yet because, one, I'm not old enough, and I'm also not a frontline healthcare worker. But there have been people that have gotten the vaccine, and they've reported some minor side effects, things like, slight soreness around the injection area, itchiness, redness. A few people had very mild cold symptoms and mild fevers, but that's just the immune system responding to the vaccination. So those are actually, positive and encouraging things. Right now, we're working on getting the vaccine out, and I will eventually get it, just like, the rest of the tribal employees and the rest of the tribal members. So I can just wait my turn. I know there are people that need it more than myself, like the elderly, and I'm more than happy to wait until they're taken care of.
Okay, is there anything else you'd like to add?
The Menominee Tribal Clinic will be doing COVID-19 testing on Martin Luther King Day. That'll be January 18th, I believe. And they're going to be doing that from 8 to noon, depending on the amount of demand for that. And also, we have a new vaccine question hotline with the tribe. The number for that's 715-994-1453. That'll take you to a voicemail, which will actually come to myself, and I'll be able to answer any questions that come into that line. So if you have questions, feel free to call. I'll get back to you either by phone or email or text.
Okay, thank you.
Yeah, thanks, guys.
Waiwanan for listening to the Menominee Indian Tribe of Wisconsin podcast. You can find us on Apple Podcasts, Spotify, and Stitcher. You can also listen to the podcast on menominee-nsn.gov under the Community tab. Keep up to date by following us on Facebook at MITW Podcast. We do weekly updates with Vaughn and welcome any community questions you have regarding COVID-19. Please send them in to us via email at podcast@mitw.org.